Hello, friends. Welcome to the Ancient Health Podcast. I'm your host, Dr. Chris Motley, and today I'm at the Health Optimization Summit, and I have a very special guest. We've already become buddies, and she just got back from Japan. It is Dr. Amy B. Killen. Be killing it, and we just had a good laugh. And I want to tell everybody out there that when they told me I had opportunity to have an interview with you, I was very excited because one thing I love about your content is that you have like good, funny, but also very informative content. I'm not saying funny as in, oh, it's slapstick. I mean, you have a really good way of communicating pretty complicated cases in a simplistic manner, and you've been doing it for a good while, and I really am thankful for it. So thank you so much for joining us today.
Thank you. This is going to be so fun. I'm really excited.
Oh, I always think that when we do a podcast, it's really to have a good camaraderie and just have like a easy, good flowing conversation. And I could tell, like when we first met, you were telling me like you had some jet lag, and you just got back from Japan from a family event.
Yes.
Right?
Yes.
And you had a good time out there.
Amazing.
Oh. And are you a world traveler? Do you like to go travel?
We travel a fair amount, and I try to bring my kids. You know, they're teenagers, so I try to bring them along and show them different parts of the world, and show them how other people live. So it's a lot of fun, I think.
And well, for everybody out there, you were in the ER, and I want to go into that, but you guys know my style. I really want people to know about you because I've read up, but they want to hear more about like you. So can you give us a little information about you and like your background?
Yeah, so I was an emergency room doctor for about 10 years. That was my initial training, residency, all of that. And I actually worked here in Austin in the ER for 7 years after initial training. And it was fun, but it was crazy. It's very high stress, as you might imagine. Like you're getting up at 3:30 in the morning to be at work at 4, and you don't sit down for 12 hours, and you don't go to the bathroom, and somehow you drink 100 ounces of Diet Coke during that entire time, but you haven't gone to the bathroom, and then you do that every single day.
Every single day. Okay.
You're like, I have questions.
Yeah, it's like truly because I had 3 patients of mine. They were ER docs, and they would say that they would. One lady, no exaggeration, drank so many containers of coffee, and she goes, "Oh, I've only been to the bathroom like twice today."
Yeah.
The whole day.
Yeah, I would regularly drink 1 to 2 Monster energy drinks, and then usually like 60 or so ounces of Diet Coke throughout like a 10-hour shift. And usually I might go to the bathroom once or none, because you don't actually have time to leave to go to the bathroom some days.
I mean,
I know. It's
that's beast mode right there, though. Like your adrenal gland. I'm sorry. I don't want to see what your kidneys and your adrenals would look like at the end of the day.
My bladder was like a bladder of steel.
when you felt that, like, did it come to the very end of the day? Seriously, and you go, "Oh my goodness, I gotta go to the restroom."
Well, you feel it along the way, but like then emergency happens. Like you get called over here, and so you just don't have always that 5 minutes to break away and take care of yourself. It's crazy.
I couldn't imagine what brought you into the ER world. Like, why did you want to do it?
I always wanted to be like a handy person to have around. Like I loved the idea that like I'm out in the wilderness somewhere and someone breaks a leg and I'm like, Amy to the rescue. So and I like that. I love the energy. I love just having diversity of people coming in. And so that was my initial reason. And I love the ER. It was great. It was a great foundational area of study. But after doing it for a decade, what happened was my kids at the time were little. So I had 3 kids, and at the time they were all under the age of 3. And I was working this 4 a.m. shift in the ER, and my husband had moved out of state for a job. So it was me, the 3 kids, and I'm getting up at 3:30 in the morning to go to work, sleeping like 3 or 4 hours a day total, and just every day, stress, and all the Diet Coke and all the bad food. And one day I was in the ER, and I was looking out at the waiting room for all these patients waiting to be seen, mostly for chronic medical problems. And I just realized that if I didn't make some changes in my life, I was going to be one of those patients in 5 or 10 years, with diabetes and hypertension and metabolic disease and heart attacks and strokes and all of these things, and that I needed to make some serious changes. So that was the light bulb moment for me.
Wow, when you realize that though, because I could see you being a very practical person, just like knowing you like A plus B equals this, so I'm just going to get this and get it done.
Yep.
When that came up and you said, well, I'm going to try to change my life, what were some of the first initial things you did? Like, I'm going to change the way I eat, maybe I change the way I sleep. What was your initials?
I couldn't change how I slept because I still was working in the ER.
I can't imagine.
And I still had the kids. I tried to start, I worked out at the time. I was working out occasionally, and I was walking all day long. So luckily I wasn't at a desk job because as we both know, just sitting is its own big problem. So I was fairly active in that my job was active. I tried to make better food choices, and I did cut down on the Diet Coke as well, although I didn't cut it out completely. And then I would spend my off time, my extra time, just starting to learn, to read. I started to attend webinars and virtual courses and things like that to try to learn more about this field.
When you learned that and you started making changes, what eventually pulled you out of the ER? Was there a time when you're like, I'm going to make a change, and then you knew your time was done? Like, what was that feeling? Like, I have to move on.
I remember the other moment. I kind of had two moments. There was the one where I realized that I was going to be sick if I didn't stop, and the other moment was the moment that I realized that even like the best adrenaline part of it wasn't making me feel good. Even the the dopamine hits that I really loved, they weren't hitting. The dopamine wasn't hitting the same. And there was a day when there were two patients that came in. They were brought in. One had a really low heart rate of in the 30s, and one had a fast heart rate in the 200s. And they both came in at the same time by EMS. And I was the only doctor on. And so we put the patients in two different rooms side by side. And I stood in the hallway directing the nurses, for two opposite protocols to get these patients back. They were almost dead, both of them. And I saved both of them at the same time, essentially. And I remember standing in the hallway, and I didn't feel anything. I didn't feel excited and proud and I did a good job. I just felt like, okay, now I got to go see this toothache and this back pain and this nurse is yelling at me, and I just was like, yeah, I think I got to move on.
Yeah, I think that when you said yes, it can't, because one of my older teachers said that they would try to train you to say, take no credits, take no blame, but it makes you kind of emotionless. But I would always want to have to counterpoint that. I would say, hey, I got to have some joy and some, feel like I did get a little pat on the back to make me keep going. So when that was done, you're like, I saved a couple of lives and now I've got to move on.
Yep.
Wow.
Yeah.
Wow. And when it hit and you knew you were going to move on, was there a level of excitement when you knew you were going to go into different summits and you're going to these different conferences, you're like, oh, because you know the information, you're like, I know this, but then there's this new information, it's twisted in a different way. And is that how?
I mean, honestly, it was mostly new information. I didn't know. In medical school and residency, you learn very little about nutrition and lifestyle and stress and how to sleep and all of these things. And then you also learn very little about hormones. I do a lot of hormone replacement therapy, which I love. I mean, that was not even talked about in medical school. I don't ever remember hearing about hormone replacement therapy. Wow. So it was an entire new world of learning. And I love learning. I love reading. I love, I get excited about that kind of thing. So I was like a kid in the candy store. I was like, oh my gosh, there's so much to learn.
when you did it, I love it because I can tell you're excited. When you decided, you went to this practice, you go, did it take you a little time to calm down from the ER, or did you just go, no, I'm going right into? Because I mean, you're living off 3 to 4 hours of sleep at night. I can tell you, that would be tough on the adrenal glands.
It was hard. I remember that when I left the ER and I started sleeping 7 or 8 hours a night, every night.
What did it do to you?
It was life-changing. Everything fell into place. It was all of a sudden I wasn't making the poor food choices. I wasn't yelling at my husband and kids. I wasn't, I didn't need 12 Diet Cokes a day. Not really 12, but I didn't need all of this caffeine. Yeah. And so for me, still, sleep is number one. That is foundational.
That's exact. When you say not yelling, I've been in practice, it's been a little over 20 years. And even with Chinese medicine practice, you get so many people that would come in, and I used to think that I'm not going to let this get to me or let it get me agitated. But there are times when I would get loud, I take care of my little Korean mom, and I'd be like, why am I doing that?
Yeah.
And why am I getting short? And I was like, oh, something's got to change because I shouldn't be that way. So you start learning about hormones. One of the things I really love about your posts, and I think it's really important, I know I'm not trying to get off line here, it's we're talking about lifestyle changes. One of the things I see on your posts is that people love you talking about hair growth hormonal. Mm-hmm. Now, I want to mix this in there, but I know my producer and a few other people want to know about it because the ladies are Wait, is that a big thing? Women came to you. I know it's like hormone change and stuff, but they're like my thinning hair and stuff. Can you touch a bit on like hair and such?
Yeah, for sure. I do a lot of kind of aesthetic, sexual health, hair, skin and hair, skin and sex, as I say.
Skin and
sex was initially a lot of my.
That's a TV show. Sorry.
No, I know. Write that down. What happened is I was doing a lot of hormone work with patients, and you've probably seen this too. Like they would come in like kind of in survival mode, like they're just really not doing well, they're gaining weight, they have low energy, et cetera. And I would start working with them on their lifestyle and some hormones, and like 3 months later they would come back and say, okay, I'm feeling a lot better, like I'm losing weight, I have motivation, I'm doing a lot better, and now can you help me with my skin or with my hair or like with one of these kind of like things that they had kind of put in the back burner. And so I started becoming really interested in this kind of skin and sex world because people care about these things, especially once they start feeling better, like just generally overall. Wow. So I love talking about it. So for hair, with women, it's much more complicated. Hair loss is more complicated than it is with men. With men, it's almost always just androgenic alopecia, which is related to testosterone and conversion to DHT. With women, hair loss is there's so many causes of hair loss. Wow. And so it's a lot more difficult to figure out what's causing the hair loss and then to figure out what are the best treatments for it. So
because I love how you're talking about like skin and aesthetics, and also too because like when you talk about sex, it's really truly like the Chinese medicine world, they always talk about your fire, like your passions in life, and you don't have any more passions in life. When we talk about your hair, it's like your beauty. Like in a woman's world, it's my representation.
Yeah.
If there's so many causes and such, are there any like blood tests or like levels a person should look out, basic blood tests that they should look out for their hair coming out?
Yeah, I mean thyroid is an important one. You can get low or high thyroid can cause hair loss, but low especially. Ferritin, so your iron stores, oftentimes low ferritin in women especially is a big contributor to hair loss. Certainly just checking all your electrolytes and all your normal lab tests. Heavy metals can sometimes cause hair loss, and then hormonal changes as well. So, perimenopause, menopause, that transition is a big cause of hair loss as well.
Yeah, when you think about so somebody said, I'm losing hair, doc. Is there any like stories that like stick out to you, like when you looked at some of the causes, like some of the causes that you thought that was the most strange cause for hair coming out of this person when you found it on a blood test? I mean, like, what is one of your most intriguing things that causations for hair loss? I love hearing these things.
Yeah, I see autoimmune hair loss sometimes, and that can be from all different. You can get autoimmune disease from all different crazy things from your environment or just various autoimmune components. That can cause hair loss. It can cause patchy hair loss sometimes, which is different than just kind of general hair loss. But I think one of my favorite catches is just iron, like just helping someone. They have low iron. Their ferritin is 20, and the lab says it's normal, and they're like, well, my lab says it's normal. My doctor says it's normal. So how is it? How it's making my hair loss? But then you get get it up to 60 or 80, and all of a sudden, their hair loss stops. Like it's an easy fix, but it's one that's missed very commonly by traditional medicine.
In traditional medicine, and it's true, it's like you find that low level, you go high, because some of the individuals out there hey, my doctor would tell me that if I'm in a particular range and I'm on the low end, because sometimes they'll say, oh, you're in the low end, but you're fine. What's your rule? Do you say something like if you're getting towards the low end or towards the high end? What's your rule?
I talk about there's the normal range, which is the reference range that the lab gives you, and then there's the optimal range. And at least according, depending on the lab tests, those ranges are not always the same. And so thyroid is a good example, ferritin's a good example, but because the normal reference range for the lab, they're taking a bunch of people, all ages, all types of health issues, and they're finding the 95% of the people, like what is normal for 95% of those people.
Gotcha.
So that's the normal range. It doesn't mean it's the healthy range, but yeah.
See, to me, I've always been really intrigued by how the numbers and levels have changed over the decades, which I think is really interesting. And I think we always have to adapt to it as doing any type of healthcare profession. When you got into, treating individuals, you had more women than men come in?
I do about 50-50. I talk about women's health more than men's health, but I actually treat both.
Really? Okay, so as men and women age, because I I have some men that come in now more that ask about longevity and aging gracefully. In fact, I'm a little surprised about how many men really go, Doc, like, I'm getting lines right here. Okay, so what would be, how could I say this? Whenever you see like they're aging, some of the hormone balancing techniques. I love on your other Instagram feeds how you talked about you have like these sets of, supplementation and sets of testing. So what are some of the like test procedures, adding in iron that you said it really helps with balancing aging hormones? Like what's your approach to aging?
Well, I like to check all the hormones and just see where we are at least with blood tests, because that's a good indicator. And then depending on, with men with testosterone, we can oftentimes help increase testosterone with lifestyle changes. So whether it's weightlifting, lifting heavy weights, maybe getting a little bit of sun can help with testosterone, reducing stress can help with testosterone, sleeping better, like just, those kinds of things, as well as making sure you're getting enough vitamin D and selenium and zinc and some of the things that your body uses to make testosterone.
Wow, that's big. So selenium, zinc, and vitamin D help with making the testosterone.
Yeah, they're required. And if you have, most people have some of those things, but maybe not optimal amounts of those. Like vitamin D is a great example.
Yeah.
So if we can just replace those, they can help their bodies to make those hormones better.
So have you ever had a time when like, a guy comes in and he's like, Doc, I'm having, some ED, I'm having some low testosterone. You look at it and you're like, you don't even have the components to make the testosterone. And just start right there and you can add it in there and they're like, things are starting to change.
Yeah, it can make a difference. I think that the micronutrients are a step, but oftentimes they're not the whole step.
Whoa.
Oftentimes you also have to, lifestyle is a huge one, for hormones, making sure that you're exercising and you're moving your body, both cardio and weight training. Stress and sleep are super important too.
Yeah.
With women's hormones, it's a little bit different because once your ovaries stop making estrogen and progesterone, which is at menopause, you don't have enough eggs, they run out, and you can't make those hormones yourself in any large amount, then there's not really anything lifestyle or even supplements that you can do to replace those hormones.
So let's back up. Like with men out there, it could be like, you definitely get your minerals and vitamins balanced. Make sure they're up to par. You need to do exercise, whether it's cardio, weight training, to get your testosterone levels up.
Both.
Sleep's really important because they'd have to do that. So the men, you know your job. Now with women, since it doesn't get produced, do you suggest different types of hormone replacement therapy, or any types of creams, or what would you suggest on that?
Yeah, for women, I suggest at least considering hormone replacement therapy with estrogen, progesterone, testosterone, bioidentical hormones, so the ones that match what your body makes. Most women can take these, but only about 4% of women in the U.S. are currently taking HRT.
Oh, that's it?
Over age 50, only 4% are actually taking it.
Are you kidding me?
It's crazy. It's ridiculous.
Because I didn't think that because the reason I'm like, wow, because there's a harder effect on women, in my opinion, as they age, that their emotions get super agitated or just very sensitive, and I would think that, man, you need to get some hormone therapies, right?
I mean, hormone therapy is not just about treating symptoms. So it does treat symptoms. It treats depression and insomnia and body aches and palpitations and all of these things that happen, as you're transitioning into menopause. But these hormones also prevent future diseases, and that's what's really important to me: preventing osteoporosis, heart disease, potentially dementia, sarcopenia, which is muscle loss, pelvic floor dysfunction. We can prevent a lot of these things with these hormones if we start them early enough and we keep you on them.
So when somebody comes to you and say, because at times they've come to me, I have two good medical doctors. They're great in my area and amazing doctors, and they deal with hormonal therapy. And they'll ask me in the Chinese medicine world, what does it do to certain organs? So if they come to you, because some out there would say, well, I guess the quality of the hormone that they're using. What would you say to that? Because some people are literally afraid. They're like, well, I don't want to do it because there's a chemical, and other people are like, well, it may be too hard on my body. What would you say to that?
Well, that's a great question. The synthetic hormones, which are the Premarin and the progestins, are the ones that were used in the Women's Health Initiative, which was a study in 2002 that came out that scared everyone to get off of their hormones. So
Really?
those were synthetic hormones that increase breast cancer risk, that increase heart disease risk, blood clot risk, all of those things. We don't use those hormones anymore. We use the bioidentical hormones, which are the chemicals match the same chemicals that your body makes. So it matches the estrogen that you make. So estradiol, progesterone. And those are very safe. They don't cause breast cancer. They don't cause heart disease. And, in fact, it reduces the risk of all those diseases. So you do have to be careful. Like, you don't want to use the synthetic versions. You want to use the bioidentical versions. You want a doctor who understands the difference between them.
That's a good point, because you're a doctor that understands them.
Yeah.
Is it few and far between the doctors out there? Because, I mean, because you have great content and you have a lot of followers, and that would tell me that a lot of people are following it because, like, there's not maybe too many doctors that are doing this kind of work.
We are seeing more and more traditional doctors, traditional gynecologists, traditional urologists now coming around to say that these hormones are, bioidentical hormones actually are better and safer.
Yeah.
But it's been a long road. I mean, I've been doing this for 10 years, and I remember in the early days talking about these hormones as being safe and effective, and the medical establishment was so dismissive and so like, oh,
Really?
you're a quack, you don't know anything, they're very judgmental, until they later saw that, we were actually ahead of the curve and not behind the curve. And so now I think we're seeing more and more doctors wanting to learn about this stuff.
I'm so encouraged because now when we know that there's a big movement, which I'm thankful that we are talking about longevity and how to make a cell stronger, and we're talking about hormones. Only 4% of women,
over the age 50, who are the ones who need it, are
word.
taking hormones.
So now, are you seeing with the people you're working with, they're reducing their osteopenia, their osteoporosis, all of those conditions? What would be some of the symptoms that a woman needs to look into? Like they're just, at home, they're listening to what we're saying, and you go, and I don't want them to get scared. We're not trying to get you scared, but they go, what are your top symptoms? You go, okay, you need to get hormones tested.
So first of all, we think, menopause on average starts at age 50.
Okay.
But you have to understand that perimenopause starts 5 to 10 years earlier.
Oh, yeah.
And also, you could have, menopause can start as early as age 40 or 45. So you could be 35 years old and starting perimenopause.
Really?
So this is not about just older women. This is women who are still in their 30s, still childbearing age potentially, but you could start having these symptoms. So that's number one. Number one. And then number two is that there are dozens of symptoms, and not just hot flashes and night sweats and weight gain and belly moving, belly weight getting bigger and things like that, insomnia. But it could be itchy ears, dry skin, waking up achy all over, heart palpitations.
Totally, that's
all
what
of
some
these things.
patients have, and they'll say I itchy and I have itchy ears and such.
It's weird stuff. Dry eyes, hair falling out, vaginal dryness. It's like your body feels like it's not your own anymore. You feel like you're like, who is this person? I have no idea. You feel, and the mood changes, depression, anxiety, panic attacks.
And they kind of just sort of interchange with each other, and then you could say, you definitely need to go get this. Because when you just, I'm going to interject on the vaginal dryness, because that's a big one too, though. It's happening, because sex, for me, with patients that come in and they'll ask me about hormonally how to shift, and there's a few good herbs I think that's really good for that. When that starts to occur, are people not say too far gone, but let's say they say, Doc, I have vaginal dryness. What are the first steps, or what are the first hormones they need to look into? So
vaginal dryness, the good news is that you can take just vaginal estrogen, low-dose vaginal estrogen. It is a prescription. It's inexpensive, and it's safe for everyone. Everyone. Breast cancer history, it doesn't matter, because the hormones stay essentially in the pelvis. They don't go throughout the body. It's low dose. So it's just it's like a cream. You just put it in 3 times a week, and it makes a huge difference for vaginal dryness, but also recurring UTIs. So people who get bladder infections frequently can make a big difference, and also urinary incontinence. So if you're having a hard time with bladder leakage, they can make a big difference if it's because of low estrogen. So vaginal estrogen is amazing, inexpensive, completely safe, and yet still absolutely underutilized.
So if a person out there is saying, I need to go talk to Dr. Amy, what would they look for? Just say functional medicine or functional gynecology? What would they look for?
Yeah, I mean, certainly functional medicine doctors will usually understand this. Traditional doctors, gynecologists, family practice doctors, urologists, some of them are familiar with hormones. I think the best thing is just to call the office and say, do you do bioidentical hormones? And if the front desk is like, what is that? Then that's probably not that's probably not where you want to go.
Excuse me? Okay, so
what kind of hormones?
Yeah. Estrogen. Just get, whenever you find a person that can do bioidentical hormones, let's talk about functional medicine, because people out there may not necessarily understand just the term functional medicine, because that's what you do. So can you just give a basic explanation of functional medicine?
To me, functional medicine means kind of trying to get to the root of the problem, the cause of whatever the issue is, whatever the symptoms are, going deeper and trying to get to the root of the problem. And oftentimes it's something weird. Maybe you have a skin rash, but the problem is actually because of your gut health. It's not always something that's easy to find, but that's the idea, is try to get the root of the problem and then use a combination of lifestyle, supplements, and then sometimes medications. I kind of merge, Western medicine with Eastern medicine, functional medicine. I kind of use a combination of things, because I think that when we put things together in the right way, that's when the patients are going to feel their best.
What is your favorite? I know you love to deal with hormones. You geek out about it.
I do.
What's your favorite? Do you like skin, sex? What is your favorite thing to work with, though? I mean, out of all of them.
I love working with all of them. I do love sexual health, because I think that very few doctors talk about sexual health and the relationship between sexual health and longevity. And there's such an interesting relationship there that, I go to all these longevity events and no one is talking about sexual health. And to me, we have studies, there's several studies now that show that, people who are sexually active, who have sex at least once a week, have a 50% lower all-cause mortality rate compared to people. Yeah, big Journal of Sexual Medicine, big studies. Now, I'm not saying that having sex is causative to that. It may be more of a correlation, but there's a strong correlation between sexual health, sexual activity, and overall health and longevity.
So, okay, and I'm not trying to be crass about anything, but if a female, male and female having sex, are there different numbers? Because in Chinese medicine, they would say for an orgasm, and not to again, we're just being scientific about it, but they would say a woman would have to have so many in a week, or a man needs to reserve their power and strength so many times a week. Is there a number that says a woman needs to have this many orgasms, or this kind of in a week or in a month? Is there a number?
I would say we don't have enough information to know for sure. The studies that have been done, the Journal of Sexual Medicine study in 2020 was men and women, 15,000 people, and in that study they found that people who had sex once a week. And by having sex, they didn't really go into details. I don't know, was it alone sex? Was it partnered sex? What kind? They didn't really go into details. But that was, once a week was associated with the lowest mortality rates. But there's been a couple of other similar studies in men out of Wales. It's interesting. I think in women, it's probably more about quality than about quantity.
Yeah.
And we have some evidence of that. There was a study in the 80s that showed, they looked at all of different lifestyle factors associated with long-term health. And they found that one of the factors for men, it was quantity of sexual encounters, or orgasms, so quantity of sex.
Yeah.
Higher amounts, higher numbers was associated with a longer lifespan.
Wow.
For women, it was the quality of their sexual encounters. And so the women who had more pleasure, who felt better, who enjoyed it more, that was associated with a longer lifespan. So I do think there's probably a difference between men and women, but we don't know for sure.
Because I had a doctor friend out of Australia, and he said for his practice, he was very adamant about men and their sexual health. And because he said, with prostate and with all the tubes down in your southern regions, he says you need to keep your pipes clean. That's how he's talking. He goes, so is there the validity of that, even in women, they'd have to keep those areas cleaned out?
We do have studies in men. Yeah, men prostate cancer. There's a decreased risk of prostate cancer in men who are over 50 who ejaculate once a week or so.
Yeah.
We don't have the same studies exactly for women. It's not as clear cut for women.
What would be like your go-to, Eastern medicine or Western medicine things to help stabilize or replenish some energy down in those areas? What would be your top considerations?
So for me, I think about sexual health and kind of in 4 categories. I think about the mental emotional piece, sort of minding the mind, if you will, and that is obviously, your brain is your largest sex organ by far and most important. So keeping, whether it's reducing stress, whether it's addressing past trauma, whether it's working on relationship, like the mental emotional part is number 1 for sure. Then I think about blood flow as number 2, because you need blood flow, into the genitalia to have erections, which men and women have erections, and vaginal lubrication and all of that. So blood flow is number 2. I think about hormones, which we talked about, and we need testosterone. Both sexes need testosterone,
yes.
And then women also need estrogen. Men need a little bit of estrogen. And then the 4th piece I think about are kind of the structural integrity of the in that area, the pelvic floor. So the muscles, the actual organs themselves. Like, so I kind of think about it in those terms. And if we address all of those areas, then we'll see improvements.
Wow, this is amazing. So do you find with a mental emotional with your patients, your clients, like can that turn off somebody's like their emotions, like just shut down that whole area?
Oh yeah, for sure. I mean, I think any kind of like past trauma and past history of issues or learning as a kid that sex was bad or things like that. Yeah. And I'm not a sex therapist. I'm not a psychiatrist. So I'll refer out to have them talk to people. But certainly that's a big problem, and especially in certain populations.
Wow. So if a person truly they say they have sex once a week. Of course, you can do bioidentical hormone therapy. We're like, yes, you need to get that checked. Men too, get their levels checked. But even just just having sex like once a week would actually be really good for their hormones because it actually naturally starts to stimulate them too.
Yeah, I mean, there's a lot of there's the question about testosterone it kind of goes up and down. I don't think that it's going to boost testosterone a lot, but it at least kind of gives you a little bit of up and down, but it can help with oxytocin. Having sex, any kind of hand-holding, intimacy increases oxytocin, which is really good for reducing cortisol levels. So that's fantastic for stress. So you don't have to be having sex, but at least intimacy
like those intimacy,
general.
like holding a hand, getting a pat on the shoulder, or like a hug.
Yeah, exactly. Dancing, or even just hanging out with friends will give you some of that oxytocin boost that is fantastic as well. And then having sex and orgasms also increase dopamine as well as serotonin, a lot of these neurotransmitters and neurohormones that can just kind of feel good and make your day better.
Oh, I'm telling you, make everybody's day better. So when we talk with sexual health and you're talking about making these changes with longevity and aging well, we're starting to see that we're trying to get all the components, like even here at the conference, like they'll talk things like resveratrol, they're talking about pomegranates, and they're talking about, I don't like the word hacks, but they're not finding like these things that we're finding in nature can actually help us in all areas of our life. Are there, I know it's very general for me to ask this, but different practitioners, like they have different hacks they love.
Yeah.
Are there some that you start off with your own life that you think, I do this every day, I do this is my thing, and it helps me out? Do you have those?
One of my biggest hacks, if you will, is spending time outside in nature. I live in Utah, so I live next to the mountains. It's for mood, but also, getting a little bit of sun we know is good for you. Not so much that you burn, but a little bit of sun on your skin is amazing. And the exercise, getting outside, walking. I just feel like anytime I'm stressed or my patients are stressed, I just say, set some time aside, go outside in nature, leave your phone behind, or turn it off, and just walk. I go out and I talk to the bears and the mountain lions and all that, all the animals that are probably around me.
I'd be running, screaming.
I'm just walking around being like, hey bear, hey mountain lion, don't eat me. But it's so good. It's so therapeutic to do that, I think.
I always say that whenever the people are the enthusiasts, I like to be out. I love hiking. But those stories about individuals who go out and they're like, oh yeah, like I saw a bear one time. I was up in East Tennessee, and I remember, I thought, could I be a mountain man? Could I be out there and see all the bears and stuff? And I was like, I don't know, maybe I could. We'll figure it out. Like I've been wearing more plaid lately, so maybe I'm gonna make it.
There you go.
Okay. Now, one of the things I want to ask you that when we talk about muscle loss,
Yeah.
'cause this is big. Like, what would be like your hack like for muscle loss? Because like I take care of my little Korean mother, and like one thing I was trying to get more collagen, a little bit more vitality, but I mean, as individuals get older, sometimes they don't really want to move around anymore. They're just kind of tired, and they're like, I really don't want to do that anymore. So I know movement, right? But what would be your thing to tell them? Like, you got to keep your strength up.
Yeah, I mean, movement, strength training, lifting weights, squats, whether it's body weights or going to the gym and pumping iron, is obviously going to be really important. Making sure you're getting enough protein in your diet. So, something near, a gram per pound of ideal body weight, ideally. That's hard to get. That's a lot.
That's a lot.
And maybe you don't need quite that much, but especially if you're physically active and you're trying to maintain muscle. Collagen, I do like collagen for helping with that. I like creatine also for women for helping just to maintain muscle mass. But those are the main things. And then estrogen and testosterone can both be helpful too for preventing muscle loss as well as bone loss. Bone loss is a huge problem.
That's a good one. That's a big one. Like when they finally get brittle bones and stuff.
Yeah, I mean, 50% of women over the age of 50 will suffer from an osteoporotic fracture. So 50% of women will get a broken bone because of just weak bones as they get older. And that's something else we can get, estrogen therapy is fantastic for reducing osteoporosis. My own mom fell and broke her hip about a year and a half ago. And it was because, she was one of the 20 million women who were affected by this Women's Health Initiative study, was told she shouldn't take hormones. So she went 2 decades, essentially without taking hormones. I eventually got her back on hormones, but she had all these years that her bones got brittle. And so she fell and broke her hip, and it's been life-changing in a bad way. And it's broken hips have a 25% 1-year mortality rate. So 25% of people will die within a year after they break a hip. So we have to think about, yes, muscle loss, but also bone loss, which you don't see, but it does happen if we don't really actively try to prevent it.
Wow. I think when my mom, she had a stroke and she fell back, and I was there, and she slipped and broke. She had osteoporosis, and we've been doing different herbals and doing some different therapies on her, and it's like it helped her bones get stronger. And I think people don't realize that bone is pretty malleable. Like it actually is. It can be soft on the inside, and you can change your bone structure. So I think to me, it's about aging gracefully and doing a good job of it. And that's one thing that I love about your page too. One of the other areas with your page that I really like is how to help with your emotions and anxieties, and some of the things you've seen, helping off with your emotional stability. So I know that hormones can help that, but is there any type of common things that you see that it really help with keeping people calm? Any therapies or even exercises people can do?
Yeah, I mean, I think exercise in general, if you're not exercising every day, that's the place to start. We know there's a huge correlation between exercise and depression. People who exercise more have less depression in general. Same thing with anxiety. It's mental health is, if you get your blood pumping, it is literally so helpful for your mental and emotional health as well. And again, getting outside, I think just getting some sun, like I mentioned before. We know there's a lot of, I don't think that people realize how beneficial a little bit of sun exposure is to mood, as well as helping to prevent multiple different diseases and such. It's just not a lot, but 10 minutes maybe a day of sun exposure is super helpful. So I think starting with the basics and then, depending on what's going on, I'm trying to think about, I don't use a lot of supplements for mood except for sleep. I'll use L-theanine or melatonin or something like that for sleep if needed.
Yeah.
But if once you get your sleep and you're stress controlled and you're exercising, those all make such a difference with mood.
I really been when you talk about your stress and you look on a hormone test. What are some of your main biomarkers that you would look at, to tell somebody out there, if you have this biomarker, you're pretty stressed, your things are out of whack?
So stress is hard because it doesn't just affect one thing. I call it stress overload syndrome, or SOS, which I think is appropriate.
Yeah.
So it's not just about cortisol. I mean, certainly we hear about cortisol. You kind of lose your diurnal cortisol curve, like you don't have the same shape of curve sometimes when you're really stressed out. So you can do it. You can do like a salivary or urine cortisol and see what that does during the day. But that actually doesn't correlate all that well with symptoms. But the thing about stress is it can affect all different parts of your body. And a lot of it we can't test for, but oftentimes just listening to a patient
is like the best thing you can do
is the best thing you can do. Because if I asked you, are you feeling stressed? Tell me about your day. What are you thinking about at night? Like, if we have a conversation, I can tell if you're stressed. And
right.
Then we can start working on the stress part of it, even without having to do any fancy testing.
Because I'm with you. I think that one of the biggest keys that I've seen in my life as I gotten older, and it is really talking and listening to their history and listening to what they say.
Yeah.
In fact, I over the years, you get to a point where you hear things and you're not trying to act cocky. You just go, I have a pretty good idea what that is.
Yeah.
And you don't even have to look at some things after a while. So with longevity and knowing what can reduce stress, what can actually for me personally, what can create is I have my walks on the beach. I used to love time in the mountains. I was a mountains guy.
Yeah.
But to me, I think visualization too of if I can't get down to the beach, just walking and having my cup of coffee, I'm pretty happy after that. So when you talk about visualization, I think it's really important too. Do you have any, maybe not spiritual practices that you suggest to people to help with their longevity? Because I've heard that can be a big thing.
I think a couple of things. With stress, one of the things that I think is important is realizing that we create our own stress. And certainly there are external events that we can't control. A death of a loved one, you're getting a divorce, you're moving, whatever. There are horrible things that are happening. But we get to decide how we think about those things. And we get to decide if it's stressing us out or not. And so I love that there's some power in that.
Yes.
That we get to decide, our brain gets to decide how we how we want to think about this event or how we want to go forward. And then, I think that there meditation of various sorts, just sitting and doing some breath work, breathing in and out slowly, or doing some counted breath work, or things that are so simple that we can do at home, anywhere, traveling. It's just taking a couple of minutes to do that. Visualization, if you have a place that you love, or think about time with your family, or things that just make you happy, just thinking about those for a few minutes. You can calm your heart rate. You can improve your heart rate variability over time, which is a kind of a longer term marker of stress and kind of the neurologic system. So I don't think it has to be fancy. Certainly there are also all kinds of gadgets that you can put on that could help with stimulating your vagal nerve, which is going to kind of reduce stress and improve parasympathetic nervous system. So there's a bunch of those that have come on the market now, and I think that those might be helpful as well.
I love it. I think that with calming the system down and visualization, when we talk about certain practices, I find myself, I'll have I count certain times, and I found as I've gotten older, have you ever found this? Maybe not. I've gotten to where in life you get to a point where you say, man, I would worry about that, but I'm just too tired to do it.
Yeah.
And I'm just thinking, why didn't I think like that when I was younger?
Yeah.
It's because your body just doesn't want to do it. It's too tired.
Yeah.
And then you don't. You're just I'm over it.
I find myself more and more saying, I could either worry about that or I could not worry about that. I can make a choice. Yeah. And especially if I can't change the outcome by worrying, then I've gotten a lot better at just saying, you know what, I'm not going to worry about it.
That's it. I had some stuff come the other day, and people around me were like, well, what about this? I was like, what's it really going to do? Am I going to sit there and just make my brain go crazy over it?
Right.
So
yeah,
this has really been good. Because are there any other parts of it? I love every aspect because you're hitting the structure, the physiology, the emotions, the chemistry. Are there any other thoughts, like if any parts of longevity that you're really diving into that you're finding new?
Yeah,
that you love?
I love I do a lot of stem cell medicine. We do a lot. We do
Ooh.
a lot of stem. We've been doing stem cell procedures for about 10 years. So I'm a big fan of stem cells and just regenerative medicine, which is either using your own cells or using other like placental or other tissues to help try to repair and rejuvenate different areas of the body. I think that's exciting. I love the mitochondrial dysfunction and trying to improve mitochondrial health with various things. And I also really like the use of some of these medications kind of off-label potentially for longevity purposes, like the GLP-1 medications. These are kind of early studies, but I think that there's a lot of potential uses of some of these drugs in different doses in different ways in combination with lifestyle and supplements and all of this that I think we'll start seeing more and more of.
Wow. So you can you use, people may want to ask, like, can you use stem cells not only for like joints and pain, but can you use them for hormones and such, or?
Yeah, I mean, you can use them for like longevity purposes. There's certainly some early studies showing that intravenous stem cells may help reduce symptoms of frailty and things like that. We don't have big studies on this yet, but there are some studies using stem cells and actually injecting into ovaries in women.
What?
To try to slow down ovarian aging or to improve fertility. I don't do those myself, but there's some research using stem cells for reproductive health as well. And again, I will see more and more of this coming out.
It's going to get bigger and bigger.
Yeah.
So where's your, I mean, it's in Utah, like you do a lot of Utah, do you have clinics around or do you just focus in Utah?
So I have 2 clinics in Utah, a stem cell clinic and a hormone kind of integrated medicine clinic. And then we actually just opened a clinic called Humanot Health here in Austin, and we're opening another one of those in Florida. I'm the chief medical officer for that company. It's a franchise longevity clinic company.
Where is it at in Florida?
It's going to be opening in South Florida.
Yeah.
In this summer, it'll be coming to Florida.
Oh, because I'm down there. I mean, because I have a small location down there, and I'm like, I got to connect with you with that because I'll have a lot of patients that need it. Okay, this is great.
Yay.
It's great. So, love the convo, and we got to talk. And I want to ask you, okay, before we head out, I want to ask you, like, what is something that somebody wouldn't know about you? Like some, not like deep, dark secrets like Chris and I were talking about. We were talking about like fun, like what would be a fun secret or something?
What's a fun secret? I have a pretty serious phobia of slugs.
What? Are you serious?
I do. I have a phobia of slugs, and it stems from when I was a kid. I know,
sorry,
it's deep. This is important stuff. This is really important. When I was a kid, we had a bunch of slugs. I lived in Texas. The slugs would come out at night and eat our cat food outside. And they would get like really big, like they're like big as your thumb or bigger.
Wow.
And they would come out. And so one day I decided to do the thing where you pour the salt on the slug, which I'd heard about.
Yeah.
And I did this with my friend, and the slug it reared up and it started screaming.
No.
Yes, it did. It was like, and it started screaming, and it was the saddest, most horrible thing that I'd ever heard. And ever since then, I have like a serious trauma whenever I see slugs.
I think I'd have a trauma after that. Are you serious? It just screamed?
It screamed. No one believes me, but I promise it screamed. It made a horrible noise. Don't pour salt on slugs, please. It's so sad.
I'm sorry, I'm not laughing at that. This all got hurt, but I was like, okay, all right.
Deep dark secrets.
I don't know if I can recover on that one. Sorry. Okay. Okay. What's your favorite type of music?
I like anything. I like kind of pop music. I listen to what my kids listen to usually at this point now.
Yeah.
Whatever my kids put on in the car, that's what I listen to.
Wow. Okay. So deep dark secrets, slugs, and pop music. All right. Well. Okay. So where can people find you? I mean, like on Instagram and on social media.
Yeah. So I'm on Dr. Amy B. Killen on Instagram and Facebook. I'm also on YouTube, same name. On Twitter, I'm on all the things. And then my website is dramykillen.com.
Okay.
That's my main website. And then I also have a couple of companies, Humanot Health.
Humanot Health,
which
I've seen it.
Is humanot.health.com. And then I have a female-focused supplement company called Hop.
That's what I was going to ask you about, the Hop, too.
Yeah,
I saw that. It was awesome.
And that is like a kind of longevity stack in a pack for women. I formulated it myself. It's awesome. And that's at hopbox, hopbox.com.
Hopbox. So you can get that so you can have it all in one area.
Yes.
Wow, this has been good. I think that anybody out there truly that needs answers, that needs, ideas and thoughts about women's health, men health too, and longevity, and like literally when you talk about skin, sex, internal health, please follow her. And I'm really glad we got to meet. I'm really thankful because when you meet docs that are smart, and they're all smart. I glean. That's why I ask these questions that are. It may sound real basic to you guys, but that's how I operate. I have to ask the most basic questions because it helps me remember. Anyway, thank you so much, and I hope you have a great time out here.
This was so fun. Thank you so much.
All right, see you guys. Have a great day. Take it easy.